So let's talk about this this idea of, is there anything that healthcare organizations can do right away to even incrementally improve patient safety, language services? Like, if you had a start here before you do anything else kind of tip, what might that be?
To remember that um, language services is all about effective communication, and that is a human-centered skill. So relying on the experts within your organization, namely the interpreters, to partnering with your interpreters to help you determine what's working and what's not working and where things can be improved, I think is it's huge. A lot of interpreters, I think, feel like they are the boots on the ground, but nobody really takes them seriously. They're not clinically, they're not part of the clinical team. So a lot of times they feel kind of dismissed or cast to the side. And especially if they're providing services on video, they are seen as more of a technology based solution when really, and so a lot of times when, when they're not needed anymore, the interpreter just gets turned off. The machine just gets turned off. There's no closure. There's no transition. So I think remembering that your interpreters are, they have a lot to contribute, and a lot, they can provide some really good feedback about what works and what doesn't work with patients. So that's one thing. Having some way to get that feedback from the interpreters. Getting feedback from the patients directly is another huge thing. I think if you can create a, not necessarily through surveys, but maybe some sort of a patient advocacy council specifically for limited English proficient patients, that would be another huge source of information. What's working, what's not working, what are they comfortable with, where do they feel the gaps are. So getting feedback from patients, getting feedback from the actual interpreters that are out there,